Bon après-midi à toutes et à tous. Good afternoon, everyone. Ça y est, nous y sommes arrivés. Aujourd'hui, nous avons atteint le premier objectif de notre plan de rétablissement en route vers la phase d'alerte verte. Nous avons réussi à administrer une dose du vaccin contre le COVID-19 à 520 913 citoyens du Nouveau-Brunswick, ce qui représente 75,1% de la population de la province âgée de plus de 12 ans. Nous pouvons maintenant prendre nos premiers pas vers la réouverture graduelle de notre province et le retrait de certaines des restrictions de santé publique mises en place au début de la pandémie. We got her done, but we have more work to do. Today, we have reached the first target in our Road to Green recovery plan. We have now vaccinated 520,913 New Brunswickers with at least one dose of the COVID-19 vaccine. So one thumbs up, one thumb up. And when we get to our next goal, we'll have two thumbs up. That is 75.1% of New Brunswickers over the age of 12. And we can now take the first steps towards reopening our province and removing some of the public health restrictions that have been in place since the pandemic began. And Premier Higgs will have more to say about our first phase measures in a few minutes. But right now, what I want to say is thank you. Merci aux pharmaciens, infirmières, infirmières praticiennes, médecins travailleurs paramédicaux et étudiants en médecine et autres travailleurs de la santé qui ont contribué à l'administration d'un demi-million de doses dans les 4 coins de la province. Merci à nos partenaires des réseaux de santé Horizon et Vitalité qui ont organisé des cliniques dans l'ensemble de la province, y compris les cliniques sans rendez-vous qui nous ont aidés d'atteindre notre objectif. Thank you to all the New Brunswick pharmacists, nurses, nurse practitioners, physicians, paramedics, medical students, nursing students, and other healthcare workers who have delivered more than 500,000 vaccine doses in every corner of our province. Thank you to our partners at Horizon and Vitalité Health Networks who organized clinics throughout the province, including walk-in events that helped us meet this target. Thank you to the 218 pharmacies that have participated in our vaccination campaign. They have enabled nearly 235,000 New Brunswickers to receive their vaccines from a trusted source in their home communities. But most of all, thank you to every New Brunswicker who rolled up their sleeves to receive a first vaccine. Your participation in this campaign will make us all safer against the threat of further COVID-19 outbreaks. Mais surtout, merci à chaque citoyen du Nouveau-Brunswick qui a retroussé sa manche pour recevoir une première dose du vaccin. Votre participation à cette campagne d'immunisation nous aiderait tous à nous protéger contre le risque d'autres éclosions de la COVID-19. In particular, I want to give special praise to young New Brunswickers, the future of our province, who came out in the thousands in the past 10 days, enabling us to reach today's milestone. We now have a majority of first dose vaccinations in every age category. And I hope that even more young New Brunswickers will seek a vaccine in the weeks ahead because that will reduce the risk for everyone. We can take tremendous pride in what we have accomplished to date, but we are not done yet. Pour une protection maximale contre le virus responsable de la COVID-19, il faut 2 doses d'un vaccin approuvé. Toute personne qui a reçu une première dose du vaccin doit recevoir sa deuxième dose. To have maximum protection against the COVID-19 virus, 2 doses of an approved vaccine are required. We need everyone who received a first dose to get their second dose. I am very encouraged by the results from the second phase of our campaign. Nearly 12% of New Brunswickers are now fully vaccinated, including 18% of those over the age of 65. We expect that tens of thousands more will be fully vaccinated in the weeks ahead, and I think yesterday there was a record in terms of booking online. 26,000 people booked appointments online yesterday. Incredible, incredible. So if you received your first vaccine prior to May 1st, you are now eligible for your second dose, and I urge you to book your appointment today. Next Monday, every New Brunswicker who has received a first dose will be eligible to receive a second dose if at least 28 days have passed since your first vaccination. We need to get second doses into as many arms as we can, as soon as we can, because COVID-19 is still with us and New Brunswickers need full protection. We need to keep the momentum going. À compter de lundi, chaque citoyen du Nouveau-Brunswick qui a déjà reçu une première dose du vaccin sera admissible à recevoir sa deuxième dose si au moins 28 jours se sont écoulés depuis l'administration de la première dose. Nous devons donner une deuxième dose à un maximum de gens le plus rapidement possible, car le COVID-19 est toujours parmi nous. And we still have 85 active cases in communities across this province. We still have people becoming seriously ill and being hospitalized, and this is still very concerning. So thankfully, the number of COVID-19 cases in our hospitals remains stable, but the threat this virus poses to our healthcare system has not gone away. With travel beginning to open up domestically and internationally, there will be new infections brought by travelers. We expect the number of cases to increase in New Brunswick, and being fully vaccinated will help protect you, your family, and your community. There is also the risk that new variants of the virus will be introduced in the weeks ahead. Until 75% of New Brunswickers are fully vaccinated, we all must continue to adhere to basic public health measures such as wearing a mask in public, maintaining 2 meters of physical distance from others, and washing our hands regularly and thoroughly. We have done great things so far, but we can't let up now. We need to build on what we have achieved. Aujourd'hui, Santé publique confirme qu'il y a 3 nouveaux cas de COVID-19. Il y a 2 nouveaux cas dans la zone 3, soit les régions de Fredericton et de la vallée de la rivière Saint-Jean. Un de ces cas est un contact d'un cas déjà confirmé, alors que l'autre fait toujours l'objet d'une enquête. Il y a aussi un nouveau cas dans la zone 6, soit la région de Bathurst et la péninsule acadienne. Il s'agit d'un contact d'un cas déjà confirmé. Il y a présentement 80 cas actifs de COVID-19, dont un citoyen du Nouveau-Brunswick qui a contracté le virus à l'extérieur de la province. Today, Public Health has confirmed 3 new cases of COVID-19. There are 2 new cases today in Zone 3, which is Fredericton and St. John River Valley. One of these cases is a contact of a previous case, and one is under investigation. There is 1 new case in Zone 6, which is Bathurst and the Acadian Peninsula, and this is a contact of a previous case. We now have 85 active cases of COVID-19. This includes 1 case where a New Brunswicker was infected outside the province. There are 8 New Brunswickers now in hospital due to this virus, with 3 under intensive care. 1 of these cases is hospitalized in another province. While our case numbers are declining, there are still many New Brunswickers and their families who are dealing with the impacts of this virus. So please remember to keep them in your thoughts and prayers as you go about your day, and please remember to continue to watch for COVID symptoms. COVID is going to be with us for a while, and the only way to stay on top of it is for people to get tested when they have symptoms, even if they are mild. Do not take for granted that if we have low numbers, that COVID is not there. It is there, and it will continue to be there. So please, please get tested. As we move to the next phase of our vaccination campaign, we will be moving quickly to get as many people fully vaccinated as we can. And when your turn comes for a second dose, please keep in mind that the 2 messenger RNA vaccines, mRNA vaccines we are using are manufactured. One is by Moderna and one is by Pfizer-BioNTech. They are completely interchangeable. They are both mRNA vaccines, which is messenger RNA. The active ingredient works the same way and each is as effective as the other. So when we look at things like comparing ibuprofen to Motrin to Advil, these are all similar medications. They act the same way and have the same outcomes. So when you have a headache, whether you take whether you take Advil or Motrin or ibuprofen, they're all equally effective. They work in exactly the same way. So, lorsque viendra votre tour de recevoir votre deuxième dose, n'oubliez pas que les deux vaccins à ARNM que nous utilisons, soit ceux produits par Moderna et Pfizer-BioNTech, soient tout à fait interchangeables. Et ça, c'est les recherches et les annonces qui sont faites au niveau national aussi, au niveau des vaccins. Ils fonctionnent de la même façon et l'un est aussi efficace que l'autre. Si vous avez reçu le vaccin Pfizer comme la première dose, vous pouvez recevoir le vaccin Moderna pour votre deuxième dose et vice-versa. Alors, si vous avez reçu le vaccin Moderna pour votre première dose, vous pouvez recevoir celui du Pfizer pour votre deuxième dose. Cette interchangeabilité pourrait vous permettre de recevoir plus rapidement les deux doses dont vous avez besoin pour une protection complète. So, if you had Pfizer as your first shot, you can have Moderna as your second, and vice versa. So if you had Moderna as your first dose, you can have Pfizer as your second. They are completely interchangeable, as announced by the National Advisory Committee on Immunizations. So we are expecting a large volume of Moderna vaccine from the federal government, and this gives more New Brunswickers the opportunity to be fully vaccinated and fully protected faster. And again, with travel restrictions easing and with border measures easing, it's more important now, more so than ever, that we address the risks that will start to increase. I encourage New Brunswickers to take the first available appointment they can to get this, and this will ensure that you have full protection as soon as possible and move our province closer to protecting our communities. We have also confirmed, based on advice from the National Advisory Committee on Immunization, that those New Brunswickers who have received an AstraZeneca product for their first dose can receive one of the mRNA vaccines for their second dose. If you haven't had your first dose, for whatever reason, it's not too late. We will continue to offer first doses concurrently with our second dose campaign. The best way to get your dose is to book an appointment with a local pharmacy or by visiting www.gnb.ca/book-a-vaccine to make an appointment at a clinic hosted by Horizon and Vitalite Health Networks. We must get as many people vaccinated as quickly as possible, and because New Brunswick will be opening up and other provinces will be beginning to open up as well. The virus will still be with us, and people will still become COVID-19 positive. By getting vaccinated, you're helping to protect not only yourself, but others as well, from transmission, from hospitalization, from ICU admission and death. The risk will never be zero, but this is our best protection. I continue to encourage all New Brunswickers to join the majority who have chosen to protect themselves against this virus. Today is not the end of our journey through the COVID-19 pandemic. We still have some distance to travel in the weeks ahead, but there is now hope that our situation will continue to improve. But we must stay the course. We must continue to temper our optimism with caution and common sense so that we do not lose what we have gained. Again, I thank every New Brunswicker who has helped us get to this very, very important day. What an incredible milestone we have achieved collectively. Let us keep going and get the job done. We need to get to the finish line together. Thank you very much. Merci.
Good afternoon. Bonjour. Today we are marking a major milestone in our response to the COVID-19 pandemic. As Dr. Russell announced, 75% of New Brunswickers aged 12 and older have now received their first dose of a vaccine. C'est une grande réussite, et nous devrions prendre un moment pour célébrer. New Brunswick is in the top 3 provinces for the rate of vaccination. Les gens de New Brunswick devront être très fiers de ce que nous avons accompli collectivement. Vous avez clairement indiqué que vous voulez continuer à être des leaders dans la lutte contre cette pandémie. I want to thank everyone who has taken the time to get that first dose of the vaccine to help protect yourself, your loved ones, your family, and your community. You've played a huge role in helping to move our province forward. I am grateful to the pharmacists and the healthcare workers in Horizon and Vitality Health Networks who have played a vital role in helping us reach this goal by administering vaccines to New Brunswickers. I also want to thank many who returned from retirement to offer service to their province and to meet this milestone. Thanks to their incredible work over the last few months, we have been able to administer an impressive 600,000 doses to more than 520,000 people. I also want to recognize the business owners who have stepped up to provide incentives, from offering discounts to gift cards to a free drink or a free snack to those who chose to get vaccinated. Certaines entreprises ont fait preuve d'initiative pour faciliter l'accès à la vaccination. Je connais au moins une entreprise de taxi dans la province qui a transporté les gens gratuitement vers la clinique de vaccination. D'autres entreprises ont offert de conduire personnellement leurs employés pour qu'ils se fassent vacciner. Ces exemples démontrent comment nous avons uni nos forces en tant que province pour lutter contre le COVID-19. In addition to reaching our goal of vaccinating 75% of New Brunswickers 12 and older with their first dose, we have also kept our number of hospitalizations low with all health zones remaining in the yellow level. That means that we can enter phase 1 in our path to green, and we can begin to loosen some of the restrictions we've been living with for so long. Effective midnight tonight, New Brunswickers will be allowed to have contact with all family and friends in areas at the yellow alert level. A steady 15 list of contacts is no longer required. Les rassemblements informels à l'intérieur seront limités à un maximum de 20 personnes. Les rassemblements formels à l'intérieur ne devront pas dépasser 50% de la capacité de l'établissement et il devra y avoir un plan opérationnel. Les rassemblements informels à l'extérieur seront autorisés si on respecte une distance de 2 mètres en chaque groupe. Les rassemblements formels à l'extérieur seront autorisés à capacité maximale si on respecte une distance de 2 mètres en chaque groupe et s'il y a un plan opérationnel. There will be no isolation or testing required for those traveling to New Brunswick from Newfoundland and Labrador, Prince Edward Island, Cumberland County in Nova Scotia, or the Avignon and Témiscouata regions in Quebec. Travel registrations for all travelers entering New Brunswick will, however, still be required. Les règles seront moins restrictives pour les gens qui se rendent au Nouveau-Brunswick pour des raisons de compassion. Les voyageurs devront encore s'y isoler, mais ils subiront un test de dépistage entre les jours 5 et le jour 7 et ils pourront mettre fin à leur isolement quand le résultat de test est négatif. Cross-border commuters and truck drivers will no longer be subject to testing and isolation requirements. Other workers, including rotational workers who are traveling from outside Newfoundland and Labrador, Prince Edward Island, Cumberland County in Nova Scotia, or Avignon and Témiscouata in Quebec, must isolate with testing on days 5 to 7. This is a reduction from the previous 14-day mandatory isolation. And we must expect this requirement will be eliminated under phase 2, which we could reach just later this week. These rules also apply to people moving to New Brunswick and New Brunswickers who travel outside the area. They can leave isolation once they have a negative test, unless they're under existing work isolation plans. Organized sporting activities will now be permitted. Games and competitions can open to those in the regions of Atlantic Canada and Quebec, where travel to our province is permitted with an operational plan. Faith gatherings with an operational plan can move to a 50% venue capacity with a choir 4 meters from their congregation. In this first step, all other restrictions to maintain public health will remain in place, including the need for travel registration and the use of masks. All of these details can be found on our COVID-19 website. I realize other provinces may have different rules for travelers, and I encourage anyone planning to travel to check the rules in other jurisdictions. I am confident the other provinces will also be opening to New Brunswickers looking to travel very soon. We know there are people who own property in New Brunswick who may want to come and have a longer visit with family, and we wanted to provide them that option. We told New Brunswickers that our plan was to open the Atlantic bubble as soon as possible, and we are on track and able to do that. I understand Nova Scotia, Prince Edward Island, and Newfoundland and Labrador have announced today that their provinces will open to the rest of Canada later this month. Again, as of midnight, people from Prince Edward Island, Newfoundland and Labrador and Cumberland County in Nova Scotia are permitted to travel to New Brunswick without isolating. Our province will soon be open to all of Atlantic Canada, including Nova Scotia, once we enter phase 2 on our path to green. And with your continued help and enthusiasm for the second vaccination, this will happen later this week. We have shown that as a province, we can do hard things, especially when it means keeping one another healthy and safe. We have shown in an unprecedented way how well we work together for common goals. La distribution des deuxièmes doses de vaccins a commencé partout au Nouveau-Brunswick. Quand vous serez admissible, prenez un rendez-vous pour vous assurer d'être protégé pleinement contre la COVID-19. With your help, I am confident we will reach our next goal, and we will be able to enter phase 2 on our path to green very soon, within days. In fact, because of the impressive progress we have made, we are no longer attaching a specific goal and timeline to this, a date to this, because we are so confident we'll be there so soon. Once 20% of people 65 and older have received their second dose, and as long as hospitalizations are low and all health zones remain in the yellow level, New Brunswick will move to phase 2 on our path to green. As of today, 18% of New Brunswickers 65 and older have been fully vaccinated, and thousands more are already booked for appointments. Il sera possible de rencontrer les membres de notre famille et nos amis de partout au pays plutôt que nous à l'avion en manger. Nous pouvons envisager un être avec beaucoup moins de restrictions. Remember that public health guidelines to wear a mask and follow physical distancing in public are still in place for now, and these actions will continue to protect us as the rules are loosened over the coming days and weeks. The third phase of our path to green, when we can lift the mandatory order and remove all the restrictions, including the use of masks, is now within sight. If we keep doing what we're doing, we can move closer from the August 2nd date. We can have more of summer with freedom. We need to stay focused. We have met such a major hurdle right now that the time is to continue that passion, continue that drive to become fully vaccinated with at least 2 doses at the 75% level. If we keep doing what we're doing and get the second dose as soon as we possibly can, we will be fully green sooner than what we had projected a few weeks ago, potentially weeks sooner. We could be in green, and imagine what that means for your family to be together this summer, a summer like we haven't had for a long time now. I'm ready for that. We can do this, and we need your continued help. Thanks for your passion. Thanks for your perseverance. Let's make New Brunswick #1 in Canada, because we are indeed on track to do just that. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup à vous deux. We'll now proceed with questions from members of the media. Each reporter will have 1 question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question seulement. Voulez-vous assurer de désactiver le son de vos micros? Maude Montembeault, Radio-Canada.
Bonjour, merci pour les bonnes nouvelles. J'aimerais que vous en avez un peu parlé, là, mais j'aimerais que vous reveniez plus en détail sur ce qui s'en vient en fait. Vous avez parlé de 18%, donc il faut avoir 20%. Puis qu'est-ce que ça va pouvoir faire? Puis dans quel délai vous êtes optimiste que ça puisse arriver?
So I think we'll probably both take a crack at that answer, but in terms of timing, I think what Dr. Russell mentioned about the number of bookings that have already been put forward, we're talking days, maybe even hours, to reach phase 2. And it's really exciting because that is a major move, and we're requiring, you know, for outside travel outside of Atlantic Canada, more access, open up to the entire Atlantic in terms of Nova Scotia. We don't have the regional issues. More travel with one vaccination for people that are rotational workers that are moving back and forth across the country. Also looking at opening up with other provinces, excluding the U.S. at this point in time, because the federal requirements will kick in there. So I think that also looking at international travels, but 2 doses required. All of this is available on our website, and I won't go through the full details, but we still require masks. I think what we're looking at, you know, when you get to the next phase 3, is how exciting it'll be to finally get rid of these masks. And that is our goal, and that's why the track we're on right now is so exciting, because not only have we reached the first phase, the second phase is within days and hours, and the third phase could be within a few 3 weeks. Far ahead of schedule if we stay on track with what we're doing. So let's not forget about going away for summer until we've met our hurdles, and then summer becomes so much more than it was in the past year.
Ce serait très gentil en français, Dr. Russell, s'il vous plaît.
Alors, comme le Premier ministre l'a dit, on a beaucoup de gens qui ont déjà faire leur rendez-vous pour leur deuxième dose. On est presque rendu à la 20% de les personnes âgées de 65 et plus. Alors, c'est sous peu, je crois, qu'on pourrait atteindre le but pour notre deuxième phase.
Bien, j'ai bien compris que on va pouvoir voyager et les autres provinces vont pouvoir venir nous voir aussi là, dans cette deuxième phase-là.
Je n'ai pas compris la question.
Maude, peut-être on peut revenir. Eilish Bonang, CTV.
Thank you. My question is for Premier Higgs, and I apologize if this was just asked. I do not speak French, but if you're so confident that the province will be hitting the necessary targets for phase 2 in, you said the next few days, the next few hours, possibly, why not confirm next week's date of the Atlantic bubble opening with the rest of the maritime provinces who announced that today?
Well, in fact, we did announce today that we are already open for the Atlantic bubble as such. The dates that were put forward by the other provinces, I think primarily Nova Scotia and Newfoundland, we're already there as to today's announcement. So we're ready for the Atlantic bubble, and tomorrow or next day when we arrive at the 20% range for age 65 and older, it just reinforces our readiness for all of Atlantic Canada. So I think we're there, but we have stuck to the percentages of vaccinations as being our guideline. I think that we feel confident about achieving that next phase this week, but as we stuck to receiving 75%, you know, we didn't stop at 70, 74, 74.5. We wanted to achieve our 75% goal. So what that means is right now, with the rate that we're seeing people getting their second dose, if all those people that chose to get their first vaccine just get their second vaccine, we're there. We have not only met the bubble targets, but we have moved beyond into opening up with other phases in total green. So let's just stay focused on that.
Thank you, Ailish. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Premier Higgs, are you expecting to greatly exceed the original phase 2 goals that you set for July 1st? And can you give us an idea of how much, and also how potentially early we could see phase 3 go into effect if it continues to roll out as it is?
Well, you know, I've learned all about projecting dates. I'm quite, I feel much more confident in projecting what has been known as our targets for vaccination. But at the pace in which we're on right now, is it conceivable to far exceed the August 2nd date? And yes, it is very conceivable. But I think it requires the level of commitment that we're seeing right now for the second dose. And you know, we'll get close and into when school's over and summer hits, and will people stay focused on and getting that second dose? That's what the hinge will be, and we need to keep the momentum going. let's go the distance and let's get to green when we have no requirements. That's our goal to open up for summer. And that, if everyone stays focused on that over the next 2-3 weeks, we could be weeks early.
Thanks, Premier. Thank you, Ms. Hogarth.
Can I just add, in terms of capacity of the number of doses receiving, if somebody wants to do some math, we're, as the Premier said, we can't always project these things, but my understanding is we have something like between 200,000 and 300,000 doses arriving in the next 2 weeks, over the course of the next 2 weeks. So if you do the math of what we have available and the capacity, there's definitely potential there.
Thank you both. Adil Ibrahim, CBC.
Thank you. This question is for Premier Higgs. Some provinces are providing an electronic record of vaccination instead of a piece of paper. So now that the borders are opening up, will New Brunswick be providing a more official vaccination record?
I expect tomorrow night when we have a COVID cabinet committee, Dr. Russell may want to talk to this, but it'll likely be on the radar for discussion. There will be a federal meeting, maybe scheduled later this week, to talk about vaccination passports. There's been, as I mentioned before, the different provinces have different views on that, so it would be nice to get alignment in that regard. Dr. Russell, have anything further to add on that?
Not really. It's something that has been discussed and will continue to discuss. And as of right now, my understanding is that several provinces have, the ones that have registration required, you upload the proof of your vaccination to that site. And my understanding is that's what's done at the federal level as well. But more to follow. It's evolving.
Thank you, Ms. Ibrahim. Silas Brown, Global TV.
Oh, sorry. Do I get a follow-up?
No, we said one question each today.
Okay, thanks.
No problem. Silas Brown. Aaron Sousa, Huddle Today.
Thank you, Bruce. My question is for Premier Higgs. So, Premier, less than a month ago, Education Minister Dominic Carty said the province wouldn't be holding vaccine clinics in schools, in public schools, due to the logistics around the extreme cold temperatures for the Pfizer, along with transportation. But obviously that has since changed, and a large influx of New Brunswick's younger population have been vaccinated. So I'm wondering what changed the province's mind around that, and how is transport working for that now? Thank you.
So this may be a two-answer question too with Dr. Russell, but I would say that we've learned a lot in managing and handling the vaccine, and also there have been changes made in the rules around how it can be managed, or what temperatures it needs to be kept at in terms of a duration. What the focus was in order to look at the schools to manage that directly was also, can you take school kids and take them to a clinic, let's say in numbers on the bus? And the idea was to get to the 12 and up vaccinated to reach our target of 75%. So while there will still be a focus on what's the best way to get kids vaccinated, it obviously, at this stage, we have been very impressed with the levels of vaccinations that we've seen from our younger population. So I think they deserve credit and thanks as well, and the parents obviously for being diligent to make this happen. So the focus on schools, and whether we need to go to schools, I think it's more how we manage maybe schools coming to the clinics. But in any case, we have arrived at the 75%. We want to go beyond that and make vaccines available, but we can now rethink what's the best way to do that effectively.
Thank you, Premier. Laura Brown, CTV.
Hi, Premier. I'm wondering, for the people who, left the province over the last week thinking that they would be able to come back without having to isolate and weren't able to, and I have been talking to some of these people, can they now at midnight break their isolation?
So are these people that have been vaccinated, and they are, so at this point,
and they just went to Newfoundland or Nova Scotia or PEI. They were within the Atlantic bubble.
yeah, I would say if they've been vaccinated that they should, they've obviously have a travel plan, they would be documented, and if they've been vaccinated, that we're likely be able to work with them to return after this. And then we will be looking at changes to the mandatory order to identify just how that'll all work, and that'll come out tonight.
Thank you, Ms. Brown. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for either Premier Higgs or Dr. Russell, whichever one prefers to answer. I took in a webinar earlier with some New Brunswick researchers talking about some of their studies on different aspects of the COVID-19 pandemic, especially with a focus on New Brunswick. And there was one researcher from St. Thomas University who says her study of communication strategies during the pandemic has identified concerns about mixed messaging and inconsistent information from both public health and care homes alike. I thought it'd be fair to give you an opportunity to respond. So my question is, what is your response to that?
You know, we did several polls throughout the process, and the numbers came back very high, 80, 90% levels. And so while there will always be critics, you know, I feel very comfortable with what I've seen from both public health, and I think what we saw from government in relation to how we communicated. And yes, there will always be questions, but whether it was our COVID-49 or COVID-19, you know, the website where we were answering questions directly that were coming and going, I think that generally what we've seen for response overall has been very positive, and I kind of prefer to focus on the positive.
Thank you. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, bonjour. Ma question, ça serait plus une précision, en fait, parce que je veux peut-être reprendre la question d'une de mes collègues plus tôt, à savoir si on suit bien qu'est-ce qui a été annoncé aujourd'hui et le fait qu'il y a 18% de population aînée qui a reçu leur dose de vaccin, on pourrait donc, si je comprends bien, ouvrir au reste du pays à compter de cette semaine. Et dans quelle mesure est-ce que c'est inquiétant pour le Nouveau-Brunswick? Est-ce qu'on est anxieux peut-être de voir ça? Est-ce qu'on est stressé un petit peu de s'ouvrir au pays comme ça après presque une année de fermeture?
Alors, je sais qu'avec les annonces et les décisions pour ouvrir les frontières à les voyageurs des provinces atlantiques comme la l'île du Prince-Édouard et Terre-Neuve à ce moment-ci, depuis le commencement du pandémie, les provinces atlantiques avaient vraiment des mesures très haut comparé à les autres endroits du Canada. Alors, premièrement, je veux juste dire que tous les succès, les réussites, c'est vraiment à cause de les provinces ici sur la côte est du Canada ont vraiment eu la chance à faire des décisions, à prendre des décisions pour protéger la population avec des protections aux frontières et les restrictions de voyage très sévère comparé à les autres endroits du Canada. Alors, à ce moment-ci, avec les vaccins, la protection qu'on va avoir, c'est vraiment avec les vaccins et continuer à suivre des mesures de santé publique qui sont encore en place. Alors, oui, on va avoir les voyageurs et commencer à minuit ce soir, ça va être les voyageurs qui viennent de Terre-Neuve et Témiscouata et Avignon et l'île du Prince-Édouard. Mais avec notre but de réussir à vacciner 75% de la population 12 ans et plus, ça on a réussi. Pour le 20% des gens 65 et plus avec leur deuxième dose, oui, ça arrive vite. On va réussir à cette but aussi. Et je sais qu'il y a des inquiétudes avec ouvrir les frontières à des voyageurs des autres endroits du Canada, hors des buts d'Atlantique, mais avec des protections en place il faut encore inscrire pour venir visiter. Il faut encore avoir des preuves de vaccination. Et il faut encore vraiment, si vous n'avez pas de vaccin, il y aura encore auto-isolement avec des dépistages de jours 5 à 7. Et il faut avoir un test négatif pour arrêter l'auto-isolement. Alors oui, c'est vrai que des mesures vont changer. Ils vont être moins restrictifs qu'avant, mais la protection du vaccin on espère que ça va nous protéger au niveau des taux d'hospitalisation et des admissions à les soins intensifs. Mais pour mesurer ça, on va continuer à surveiller très prochement. Ce n'est pas quelque chose qu'on fait avec tout à coup. C'est quelque chose qu'on va continuer à surveiller parce que nous, on a des inquiétudes, nous aussi, pour faire certaines que la population continueront à être protégés avec les mesures qu'on a en place et avec les vaccins. C'est pour ça que c'est très important que les gens reçoivent leur deuxième dose aussitôt que possible, à le minimum de 28 jours avant la première dose et la deuxième dose.
Merci beaucoup à vous deux. Adam Harris, Brunswick News.
Thanks, Bruce. Question for the Premier. The July 1 target allows all Canadians to visit New Brunswick, and those with at least one shot to do so without isolating. But those with the no shot would still need to isolate and then get tested. I just want to know how you plan to police that, and yeah, basically, how do you police that?
Well, nothing really changed on our current program, so the mandatory order will reflect, changes to the requirements, but we still have the same rules and regulations in relation to monitoring and following. And in the case of air travel, registering to come here will still be required. So we will track it the same we've been tracking all along, people coming and going, and monitoring people moving across the border. So nothing will change in that regard until we've actually got to phase 3, in which the restrictions are no longer required.
Thank you, Mr. Harris. Rachel, allnewbrunswick.com. Rachel? We'll cycle back to you. Savannah Odd, Telegraph Journal.
Hi, Premier. My question for you is about the outbreak at Manoir Bellevue Special Care Home. WorkSafe reports show COVID rules were not being followed by employees, and the home didn't produce a proper operational plan until 6 weeks after those issues were first identified. 9 people died in this outbreak. I'm wondering if you feel that situation could have been handled better, and should there be consequences for the home?
Well, certainly the report on the home was disappointing, and I guess without question could have been handled better in relation to adhering to the rules and regulations and the requirements. I guess it would be yes, there should have been a closer link to protocol and a quicker response to public health requirements. Where it goes from there, I guess I haven't reviewed any of that in detail in relation to further understanding, but I guess it just signals, how significant it is, how significant it was to follow the rules and to all be part of the success. Because when that hasn't been done, we've seen the results. So it's unfortunate what we saw there at that home, and I guess at this point I'm not going to comment on whether there's any further action required or not.
Thank you, Premier. Thank you, Ms. Odd. François Vigneault, Radio-Canada.
Cette question s'adresse à la Dr. Russell. Dr. Russell, depuis tout à l'heure, et je vous dirais aussi presque depuis un an, on entend beaucoup parler des pourcentages, des dates, des chiffres, des données. Mais aujourd'hui, dans quelle mesure, en tant que médecin hygiéniste en chef, êtes-vous fier de la population du Nouveau-Brunswick qui a atteint ce pourcentage tant désiré là?
Moi, je suis tellement fière de toute la population du Nouveau-Brunswick parce qu'on a fait beaucoup de travail collectivement. On a fait beaucoup de sacrifices. Les mesures qu'on a mises en place pour protéger la population contre des effets très négatifs au niveau des hospitalisations, des admissions aux soins intensifs et les décès, c'était tellement dur sur la population. C'était vraiment quelque chose qui a touché toutes les gens, peut-être d'autres régions plus sévèrement que d'autres, mais on a réussi collectivement comme une province de réussir à vivre à vivre ces restrictions, à vivre ces sacrifices entre des membres de famille, des membres de communauté. C'était vraiment un voyage très long. Et pour réussir à ce premier but, c'est tellement, j'ai beaucoup de fierté pour tout le monde qui a travaillé tellement fort. Et je sais que même le santé mentale des gens ont vraiment souffert. Et je peux seulement féliciter les gens en ce moment-ci pour être tellement résilients d'avoir l'appui de les uns les autres dans leur communauté, les proches, leurs familles qui étaient ici, leurs collègues, leurs employeurs, les employés. C'était vraiment pas quelque chose qu'on aurait pu faire si on n'a pas tout ensemble travaillé et vraiment nous appuyer tous les uns les autres.
Merci beaucoup, docteur. Nicolas Steinbach.
Bonjour, bonjour. Question très simple. J'aimerais avoir une réponse en français et en anglais, autant que possible. Est-ce que je comprends bien, donc, que dès cette semaine, le Nouveau-Brunswick pourrait ouvrir sa frontière avec le reste du Canada?
Yes, it could indeed. That would be if we reach the next phase, then we follow the phase 2 guidelines, and that would mean we can open with the rest of Canada under the guidelines and monitoring of traveling. So that, I think that's good news, and we hope to achieve that this week.
En français, si c'est possible aussi, Dr. Russell, si c'est possible.
Oui. Alors, c'est bien, vous avez bien compris que si on réussit à notre deuxième but d'avoir 20% des gens âgés de 65 et plus avec leur deuxième dose, en plus de les 75% avec leur première dose, ça veut dire que les frontières vont être ouvertes pour les gens qui voyagent d'autres endroits du Canada. Mais, sauf que ça va encore demander que les gens sont inscrits pour entrer au Nouveau-Brunswick et ceux qui n'ont pas de vaccin, ils vont falloir auto-isoler pendant 14 jours. Mais il faut avoir leur test de 5 à 7 jours pour être la possibilité de finir l'auto-isolement plus tôt. Les gens qui voyagent de d'autres endroits du Canada qui ont une dose du vaccin vont pas avoir besoin de auto-isolement. Alors, c'est très important pour le message que c'est pas juste que nos frontières sont ouvertes. C'est pas comme ça. Vous avez besoin de s'inscrire pour venir à visiter la province et il faut avoir le dépistage si vous n'avez pas de vaccin et faire votre auto-isolement. Mais sauf que si vous avez un dose du vaccin ou 2, vous avez pas besoin de auto-isoler.
Merci beaucoup.
Derek Dubé, TVA. Derek. Bobby Jean McKinnon, CBC.
Yes, thank you. Premier Higgs, the people who have been vaccinated in the last 2 to 3 weeks don't have the full protection of the vaccines yet. So why is the province loosening restrictions and opening its borders today instead of waiting until they do?
Well, I think from the very start, what was recommended from public health is that if we reach the 75% level, that we would be in a good position to be able to mitigate the risk and to continue to follow the rules, continue with masks, continue to social distance, but it would allow us to open up in the next phase. So I guess that what we see here is that now we've reached that, we're able to do that. And I guess the next phase is coming a little quicker maybe than what we would have originally anticipated. But we still need to follow the rules in terms of wearing masks, and that's the reason. And by the time we get to the phase 3 level, that duration of 2 weeks will be well in hand of the first dose. So that's why we can't lift all restrictions and monitoring in this phase or the next one. It's to give that time, but also the time to be able to have the second dose. So it's a process of opening and a gradual one, but the rate of vaccinations is very impressive at this stage.
Thank you. Simon Delatte, l'Acadie Nouvelle.
Oui, je voulais savoir, est-ce que vous anticipez qu'il soit possible qu'on arrive à la phase verte, donc la troisième phase de déconfinement avant le début du mois d'août? Est-ce que c'est possible?
Oh. OK, je vais prendre la question. Le premier ministre a déjà dit en anglais que si on atteint le but d'avoir 75% des gens de 12 ans et plus avec leur deuxième dose, si ça arrive avant le 2 août, que oui, c'est possible qu'on pourrait arriver à la phase verte avant cette date.
Sarah Seeley, Brunswick News.
So my question is for Premier Higgs about a group of residents from different sectors that sent a letter to your office asking you to make a public statement on whether merging the two health networks was going to be something that's possible in the future or not. And I was just wondering if you've received that letter and if you're going to be making a public statement on that.
Well, I just received the letter, so I haven't had a chance to really review it in detail. I think that, you know, just on the surface without going through it in depth, certainly there isn't a plan to merge the two health networks. We will continue to have a French network and an English network. So I think that the points that I've been raising have been related to our ability to work together and to maximize our capability. And the issues that have been raising of late have been related to, you know, the healthcare workers and the shortage of workers and the bill and the need for us in order to provide certainly immediately relief, because no one should be working or even suggested to work 24-hour schedules. We need to find ways to work together. And that's for the best interest of our continued healthcare. And then long term, it's for the best interest of us figuring out just how good we can be. I have referred many times to this COVID experience. And, you know, adversity kind of breeds innovation, and it builds a character and a willingness to think differently and deliver on better results together. So how we do that, I don't know. But I know the Minister of Health is dealing with and talking with all kinds of professionals in our system and all kinds of workers in our system in order to figure out how we can provide the absolute best health care for our residents in New Brunswick.
Thank you, Premier. Thank you, Ms. Seeley. Tom Bateman, Brunswick News.
Good afternoon, Premier Higgs. What is preventing better alignment on the various reopening strategies that we are seeing across the Atlantic provinces? And if you'll indulge me, how big a factor is the economic benefit that presumably comes with being the first to welcome the rest of Canada in New Brunswick's decision to go first, or presumably to get to that?
Okay.
Thank you.
Thinking of I guess the last question first, in relation to the factor, what I'm very proud and pleased to say is that through this entire pandemic, we've worked very closely with public health, with my colleagues politically, with the COVID cabinet, and with cabinet to come up with a strategy with healthcare always being first and foremost. And so the only economic strategy that I think has been helpful throughout the entire pandemic is how do we follow the rules closely and protect our borders to ensure that we can continue to have our businesses operate. And that's been a fundamental principle from the beginning. But what it took was a higher level of diligence in terms of following public health rules and monitoring our border activities so that we minimized our exposure and our risk. And what is so, I guess, encouraging right now and is to be able to say that, you know, we did that and people in New Brunswick did that. And yes, we had a few minor areas there and there, but minor in the scope of what we've seen around us. That we've said, wow, this really kept our businesses running. And yes, some have been hit harder than others. So that point has been the driver all along, is how do we follow the rules and be diligent about it? And the people in New Brunswick have responded to that without question. the area of terms of alignment, we all have different phases of where we see our provinces, and you know, I know that what we experience or what we've seen as an experience with outbreaks, where we had some zone outbreaks, as we had in the Edmonton area early in the year, what Newfoundland had in their relation, what Nova Scotia is now coming out of. So it means we're all kind of at a different place, but at the same token, you know, we announced our path to green probably 2 or 3 weeks ago. And so we're staying on that path, and it had some very clear guidelines on what to achieve. And I don't think New Brunswickers would have been very happy if we would have delayed when they had worked so diligently to achieve the outcomes. So, you know, people need to be rewarded for great behavior, and what we've seen is great behavior here to keep our province safe. And our path to green is one that's been developed by New Brunswickers, working with New Brunswickers and my colleagues in public health and throughout government and outside of our government. I'm excited about where we are as a province. And so we're moving along based on meeting our requirements, health first.
Thank you, Premier. Thank you, Mr. Bateman. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour le Premier ministre qui est un suivi en fait à la question de Sarah sur les réseaux de santé. Une question à 2 volets d'ailleurs. J'aimerais savoir, Monsieur le Premier ministre, sans fusionner les réseaux de santé, est-ce qu'il pourrait y avoir une fusion de certains des services? Et est-ce qu'il pourrait y avoir aussi une administration pour chapeauter les 2 réseaux de santé? Et j'espère que c'est clair.
Thank you, Michelle. You know, I don't know what could be. What I would like to really focus on is what potential do we have to provide better service for New Brunswickers? And as I said, you know, the minister has gone through great lengths talking with communities around the province and virtually through the pandemic to get views directly. And now the effort is focused to the professionals working within the health authorities. It was brought on certainly in a real way with the shortage of staff in relation to services being provided. So the reality of where we are is that we aren't going to be able to go out and hire all kinds of more nurses and doctors, and we need to find the best way to work together for service delivery. And I think the point I would like to make is let's not put barriers around that, other than we will obviously maintain our French hospital network and our English hospital network. And we just have to find a way that we can maximize our capabilities within both of those networks. And let's not build barriers around that. Let's let the health professionals just imagine how good a healthcare system we can have. A healthcare system that, you know, goes well beyond the lights being on, but means that we can deliver service at record pace, just as we're seeing the vaccinations and the rollout to get beyond COVID.
Thank you, Premier. We're going to cycle back. Silas Brown.
Can you hear me now?
Loud and clear, pal.
There we go. Better late than never. So this is for Dr. Russell. Dr. Russell, you mentioned in your remarks that it's somewhat expected that cases will rise as we loosen up our borders. I'm wondering what what sort of a spike you might be anticipating with the modeling, and how much of a spike would be kind of an impetus for potentially rolling back measures, reintroducing restrictions, and potentially looking at, okay, can we have the borders open as much as we would like right now?
Great question, Silas. I actually was speaking with Minister Shepherd about this before the press conference. There is modeling that shows, actually not modeling, sorry, epidemiology has shown throughout the pandemic that the case counts per 100,000 in Atlantic Canada have always represented a small percentage proportionately from the cases per 100,000 in the rest of Canada on average. And so you can see a parallel epicurve throughout the pandemic, whereby because of our stringency measures, which are evidence-based and also have a very direct impact on case numbers, we've seen that throughout the pandemic. So what we're looking at now is trying to find that sweet spot between releasing restrictive stringency measures from a public health perspective as protection with the vaccines increases to give us that same outcome of having a low number of hospitalizations, a low number of ICU admissions, and a low number of deaths. And those numbers can be calculated somewhat with respect to modeling around, again, the low numbers that we're seeing domestically across the country. So we're seeing very dramatic drops in numbers on average across Canada right now. And so if our stringency measures were to continue and our vaccine rollout continues to be as successful as it is, then again, you can see the protection level being able to be maintained while stringency measures are decreased with respect to border restrictions and travel restrictions. We will expect people to still continue to keep their physical distancing. We expect people to still wear their masks. Testing will be crucial to continue with our success that we've seen. So at this point in time, all we can say is that we want to maintain the same level of success with respect to keeping our hospitalizations low, ICU admissions low, and a low number of people having passed away with COVID. We want to continue with that same success without the same level of stringency measures with respect to travel restrictions and border measures. And the vaccination rates are going to replace that with respect to protection. So it's really important that everybody gets their second dose. As you know, that the second dose is what gives us our maximum level of protection. And that level of protection is against hospitalizations and ICU admissions. So again, we really all have to collectively work towards getting to those second doses. We've done an amazing job getting to these first doses, but we will continue to monitor very closely how things go with this rollout as we change the measures at the borders and with travel restrictions. And again, this is a gradual change because we're going from our partners in the Atlantic provinces, PEI in Nova Scotia, PEI in Newfoundland, as well as part of Nova Scotia, Cumberland County right now, and then Avignon and Témiscouata on our Quebec borders. So we're gonna be doing these changes while we continue to monitor the situation around maintaining the self-isolation requirements for people who aren't vaccinated, and making sure that they have their day 5 to 7 test to be released from self-isolation.
Thank you, Premier. Doctor, sorry. Thank you, Mr. Brown. Rachel from allnewbrunswick.com. TVA. Well, ladies and gentlemen, that concludes today's update. Thank you very much. Merci beaucoup tout le monde. Voilà la fin de notre mise à jour. Merci.